Hey, hi everybody, it's Bill MacPhee with Mental Health Recovery Blog. I'm your host, Bill MacPhee, and as you know, our definition of recovery is when you wouldn't want to be anybody else but who you are today. Today we're at the Toronto, Ontario at the 168th annual meeting for the American Psychiatric Association held here in Toronto. And today with me we have a guest. We have Tariq Hassan. Tariq is from an assistant professor of psychiatry from Queen's University here in Canada. And Tariq has done a fascinating study, a poster on depression or on mental illness with psychiatry. So if psychiatrists came down with the mental illness, what they would do. So I'm going to ask you, Tariq, so tell us a little bit about your poster and maybe introduce yourself, a little bit about your background, and then we'll talk about your poster.
Thanks a lot, and for asking me to, just share some results of my study. So my name is Dr. Hassan, so I normally work in forensic psychiatry in Kingston, and I've been in Canada for the last 5 years, and I've got my psychiatry training in the UK. So while I was in the UK, actually, it was one of my consultants over there. He used to do a clinic for psychiatrists and for physicians. And the question I asked him was, okay, what would we as psychiatrists do if we were to become mentally ill? We talk about stigma, and we talk about destigmatizing mental illness and bringing it in line with general medicine.
Right.
So then we asked that question. So I brought that same question here to Canada, and I asked that question to all the psychiatrists in Ontario. So it was over 1,200 psychiatrists, and we had a 40% response rate.
Right, that was like 400 and something, correct?
Just over 450, yeah, exactly.
Okay.
So we asked, and it was a simple question, and we didn't want it to make it too laborious, and just ask really 3 fundamental questions. Number 1, if you were to develop a mental illness as a psychiatrist, that would affect your day-to-day functioning, your interpersonal relationships, your work.
Right.
Who would you contact first?
Okay.
The second question was, if you felt that you needed outpatient treatment, right? What kind of outpatient setting would you prefer? Would you prefer a local setting? Would you prefer out of area setting? And then we asked the third question: if you were to become ill to the degree that you needed inpatient treatment, where would you want inpatient treatment?
Right.
Would you want a local one, somewhere out of city? Would you want to go to a government hospital or maybe even a private setting? So, and one of the last questions was, what would influence those decisions, and whether at any point you've actually experienced a mental illness at any point in your career. And actually, that was one of the interesting ones in which almost a third of psychiatrists have had mental illness at some point in
Now,
time.
was it disclosed what mental illness or not? It was just broad, say mental illness?
It was broad.
Yeah, it was broad. So you don't know whether it was, say, bipolar, depression, but
That's right.
probably though, with statistics, probably the majority would have been depression, most likely.
The majority would be
probably, yeah. So then what kind of answers did you get now? This is great.
So that was interesting because, as physicians, as psychiatrists, we talk about destigmatizing things. So the answers we got was, you see, junior psychiatrists, those who have just completed their training, they're in independent practice, and probably the junior ones would actually, their concern was more about confidentiality. So if they were to become mentally ill, their concern was predominantly that their records, and understandable, should be kept confidential.
Right.
However, the problem was they would choose confidentiality over quality of care.
Right. Well, probably because a big reason of that is that you said it's they've been practicing for under 5 years, and they want a long career, and they probably thought the stigma would affect their career as in psychiatry.
And that's right, and that's actually part of the difficulty as well, is because probably we as psychiatrists need to do a better job at marketing and educating our colleagues that it's okay to be ill.
Right.
It's not your fault to be ill.
Yes.
And if you do become ill, your licensing college, your colleagues, and your fraternity as a whole will support you.
Yeah.
Not the opposite, which is what people think, right?
Yeah,
they think,
absolutely.
something's going to happen. I'm not going to get my job, or this and that and the other. So, and there is help out there for people who become mentally ill.
Yeah. Now, I'm just saying, I can remember talking to a doctor, psychiatrist before, where one of his best friends or somebody he knew very well came down with depression,
Right.
and he didn't tell. He knew his best. He knew a close friend was a psychiatrist,
Right.
but didn't tell him or disclose. And I know my friend, who's a psychiatrist, was very hurt by that, saying, why wouldn't you come to me? And again, that talks about the stigma. Now, Tariq, was there in the questionnaires? Was there what proportion were male and female?
We didn't even ask that.
Oh, you didn't
question.
ask that, okay.
So the only identifier we asked was their degree of experience, or number of years as a psychiatrist. So 0 to 5 years, 5 to 10 years of experience as a psychiatrist, or greater than 10.
Okay.
I purposefully chose not to even ask the male-female question because it's such a, because response rates are usually very poor in surveys.
Right.
So we got around a 40% response rate. Probably one of that was to try and minimize people thinking that,
Right.
is there any way they're going to kind of trace this back to me or something?
Right.
So we even personally didn't even ask that question.
Okay. So you did study the 5-year people has been a doctor, psychiatrist for 5 years and less, and then and they said that they would go treatment inner city, but confidentiality was very important. So now, what about the other groups? And now, what other group did you study? How practicing?
Right. So then you have, if we focus on the two polar groups, so you one with the 0 to 5 years, less than 5 years of experience, more than 10 years of experience. Now, the more than 10 years of experience, interestingly, they're the ones who, for them, professional standing was a key component. Quality of care was important as well, but professional standing was something that would affect their decision in disclosing, in choosing a psychiatric facility. They were also more likely to choose a facility closer to home, as compared to the junior psychiatrists who would prefer somewhere else. So that was also an interesting. Yeah.
So did these results, was that shocking to you? Or did you have any preconception of what the data would show?
My preconception had been is that the junior psychiatrists probably would be less stigmatized by things. Probably because I think there seems to be more awareness of mental health now.
Yes.
It's more mainstream. I mean, you're doing your blogs and keeping people educated about these things.
Right.
But the degree to which stigma was still a big fear factor was concerning. But then at the same time, it wasn't. You see, stigma in mental illness starts all the way from childhood. It starts in the school ground, and it continues building. So to suddenly destigmatize an individual overnight but it takes time, and it takes an effort.
And I imagine too that as a psychiatrist who see patients all the time, recognize the stigma and try to tell their patients that with proper medication, psychosocial rehabilitation, your life is not over. You still have many in life, and so really, probably a lot of them in their mind are saying, well, you know what, I really need to practice what I preach to a certain degree.
That's
you know what I mean?
That's right. And I think that's where education comes in for medical students. And there's a shift now in that, you see, we're trained as physicians, as psychiatrists, in how to interview a patient. The empathy, the discussion, the information sharing, and also the feedback.
Right.
But we've not normally been trained how do you have a discussion with a patient who's a physician, because that discussion sometimes is slightly different.
Right.
Not saying that physicians should be treated absolutely differently, but the mode in which you have that interaction is different. Their fears and worries would probably be different to a non-physician.
Right.
I mean, that's just naive. As they say, physicians make the worst patients.
Yeah.
So you have to be able to try and
And there is I don't know. I don't know if the statistic is 100%. Kind of going off topic a little bit, but there is a high rate of suicide within psychiatry, within psychiatrists. Is that true?
That is absolutely true. So physicians are more likely to commit suicide than the general population.
Yeah.
They're also more likely to get involved in addiction than the general population as well.
Right. Now, did you study, I know you mentioned a mental illness, but was there any addiction part to that? Was there an addiction part to it?
Good question. We actually did ask a question about addiction. So the question was not specifically as to what medication have you ever been addicted before. It was trying to elicit some symptoms, but that was not filled out at all. So that may give some indirect suggestion that maybe it is an issue, but people are still fearful of disclosing it. So we did ask some questions. We didn't really get much of a result from it.
Right. So in conclusion, then, what does this tell you? And And what practical applications are going to come out of this study, or continue? Do you have another study in mind that you're going to follow up, or?
Okay, that's a good question. So what's come out of this study is that we have actually developed a little bit of a working task group in Queens to look at physician mental illness and to try and link up with physician health programs. So in Canada, every province has its provincial college which regulates the physicians, and they have what's called a physician health program. So we've informed them also of our results. And what's important is the education. It's telling physicians that, look, you're not going to be penalized. You're not going to get your license taken away. Actually, there was a gentleman from the States. He just mentioned the physician diversion program that occurs in the States, which actually has some very good results. We'll be interested in learning from him as well and sharing that with our colleagues.
Well, listen, thanks, Tariq, for
Thank you very much.
talking about your study. Would you like to talk again about anything else, or anything else you'd like to talk about your study, or make a point of, or we pretty well covered it?
I think we pretty much covered it. I think the main thing is education. I mean, obviously we have to educate everybody else, but I think our physicians need to...
And there is help out there, right? If you are a
Absolutely.
physician struggling, there is help out there.
Absolutely.
Yeah, very good. Well, Tariq, thank you for doing this blog, and
Thanks for
have a
asking me to do it. Appreciate it.
good conference, the rest of the conference.
You too.
Thanks,
Take care.
sir. Bye-bye.